years, I've not been able to stand that long. 2.5 weeks into wearing the X39 patch, the pastor said, "You can now be seated." It dawned on me at that moment that, my goodness, I've been standing this whole time, didn't realize it.
After starting using the technology for approximately 2 weeks, my pain completely disappeared.
32 years of pain gone in 3 days.
I just love the products. They just help me to feel younger and younger year after year.
Thank God for X39.
My skin become younger, softer, firmer.
It's been really amazing.
I love X39 because it really helped reduce the inflammation in my knee. I can now run again. Woohoo!
Good evening, everyone. Welcome to our Tuesday evening call where we do an introduction to LifeWave, a very special company. I'm your co-host, Robin, along with Gregory. And what we do in this call is Gregory will do a short overview of the company, the technology, the founder, introduce the star of the show called X39, and then we introduce our special guest for the evening, and we have Dr. Stuart Freedenfeld this evening, so I'm excited to have him with us. And then after that is your turn. And so if you have stories to share or questions to ask, you can put them in the Q&A section, and thank you for remembering to do symptoms only. So let's get started. And Gregory, turning it over to you.
Well, thanks, Robin. And I'm just going to jump right into our short introduction this evening about activating your stem cells. And we've got some really exciting information to share with you. And I just wanted to, on a personal note, a few years ago, I finally figured out what I want to be when I grow up, or when I get older, and that's younger. And I bet you many of you can relate to that. In fact, let me switch it and ask you a personal question. If anything were possible, if you could wave a magic wand, what's one thing you choose to experience differently in your health or in the health of someone you love and care for? And what difference would it make for you or them to experience a change in that area? And with that being said, let me just give a general disclaimer that our products are not designed or intended to heal, treat, diagnose, or cure any disease. They do, however, help our bodies get back into a very healthy and regenerative mode, and many times wonderful things then begin to happen. So let's talk about the stem cell revolution, because we believe everyone wants to look, feel, perform, and live younger, and we found that stem cells are the key because they're a vital part of our immune system that repairs and regenerates damaged cells in all of our muscles, bones, organs, glands, skin, everywhere throughout our body. The problem is, the older we get, the less stem cells we have. And by age 60, only a small percentage remains. And the fewer stem cells we have, the faster we age and the slower we heal. So what about stem cell injections? Because they become quite popular, but you know what? They're also quite expensive. They can be painful, risky, controversial, and no guaranteed results. You could spend tens of thousands of dollars on stem cell therapy and maybe get marginal results, maybe great results, maybe no results, but there's no guarantee. Well, we've got good news for you, because you can look, feel, perform, and live younger with a historic breakthrough in stem cell activation. It's a new wearable technology in patch form. It's affordable, safe, non-invasive, and it's drug-free. It's actually a patented form of phototherapy that uses very specific frequencies of light to increase and improve stem cell activity. Now, this is the brainchild of our visionary founder and CEO, David Schmidt. And David is not only a brilliant scientist and researcher, he's a genius inventor with over 130 patents and patent pendings, and he's been on the leading edge of phototherapy research and science for over 20 years. Now, David's already conducted over 80 clinical studies proving the efficacy of LifeWave phototherapy products, and many, many more are in the works. And that's because LifeWave is a science-based company. It's an 18-year-old advanced technology company focused in the area of health sciences. It was started back in 2004 by David based on an energy enhancing technology he developed for Navy SEALs to increase their strength, stamina, performance without the use of drugs, stimulants, or caffeine. And it turned out to be so effective, it's now used by world-class athletes around the world in almost every sport. We have our corporate headquarters, laboratory, and manufacturing in California, Utah, and Ireland. And we have global distribution to over 75 countries with 15 global distribution centers. Now, as the word is getting out on LifeWave and our patches are being used by pro and amateur athletes around the world, and so the media has begun to notice, and you know what? You might too, if you look carefully at some of your favorite athletes and Olympians, and you see these auspicious little patches that look like Band-Aids on their bodies, and that's LifeWave. That's our LifeWave phototherapy patches. So let's discuss how this amazing technology actually works. And as I said, it's based on a type of light therapy called photobiomodulation. And LifeWave patches contain very specific combination of organic materials and nanocrystals. And when they're applied or near the body, they're activated by our body heat, and they begin to emit a very specific wavelengths of light, which stimulate targeted and beneficial biochemical responses in our body. This is known as photobiomodulation, and it is the basis for the LifeWave phototherapy patches. Now, it's been a well-recognized and proven scientific principle that specific frequencies of light can cause very specific changes within our body. For example, when we go out in the sun, a specific frequency of light causes our body to make vitamin D. We're not getting a vitamin D download from the sun, but we're getting a download of a light frequency, and our body responds by manufacturing vitamin D. And likewise, another frequency of light causes our body to manufacture melanin, the chemical that gives us the suntan. Well, LifeWave's patented technology is based on the same rock-solid, widely recognized and accepted scientific principle. Now, our focus for the last 14 years has been in the field of anti-aging and regenerative science. And in 2019, we released to the global market the LifeWave X39 stem cell activation patch. And this truly has been a historic and affordable breakthrough in stem cell activation, because some are actually calling it the holy grail of anti-aging and restorative science. And we're actually doing what the multi-billion-dollar companies in big pharma have not been able to do. And that is X39 activates a specific copper peptide that activates our own stem cells. And at the same time, it's altering gene expression towards a younger and more vibrant you. So it truly is a game changer and a major breakthrough. And our founder and CEO, David Schmidt, says, this is my greatest accomplishment yet, with an emphasis on yet, because David spends more time in the laboratory than in his office. And so, yes, we have patents. Yes, we have clinical studies. Yes, we have field results proving that LifeWave X39 is actually turning back our biological clock, helping people to look, feel, perform, and live younger. And for us baby boomers, this is very exciting news. So that's what I had to share, Robin. So I'm going to turn the rest of the call back over to you and our good friend, Dr. Freedenfeld.
Thank you, Gregory. That was wonderful. As always, you know, it's amazing how many times I've heard that, and I always learn something new. And David Schmidt is constantly creating new things in the lab, and we are so blessed to get to share them with the world. And I shared some patches with my trainer today, and she goes, "They're magic." And I love that because it feels like it, but we know it's science. So let me introduce our special guest this evening. He comes to us. He is a medical doctor. He graduated with honors, and then he went into family practice. And after family practice, he loves to be an instructor. So he's been an instructor in many places, including Rutgers Medical School. And then something very interesting happened. he got introduced to some different modalities of healing that were outside the medical school model, and started to integrate and learn about herbal medicine, nutritional medicine, IV therapies, Chinese herbs, many different modalities. And now he's known as one of the experts of integrating and incorporating these multiple different healing modalities to give patients what's best for them. And he just recently returned from Antarctica. He's my favorite 74-year-old soccer player. So, Dr. Stuart, are you here? Do you see him, honey? Gregory? Dr. Stewart? Let's find him. Okay. Let's see here. Okay, I think we got him. Are you here, Dr. Stewart? There you are. Sorry about that. You want to unmute and put your camera on so we can see you. There you are. Welcome back.
Wow, that was a maze.
Yeah. You know, technology is interesting, isn't it?
Is it? I try someday.
Welcome back.
Thank you. How are you?
I'm really, really well. This is
Oh,
our
my
first time in the new year, so happy new year to you. Nice to be
Thank
with
you,
you
and
as
to you.
always.
You
So,
got
any new great stories about patches you want to share before we jump in?
Nah.
No? Okay. Do they help in your hiking in Patagonia?
Oh, Patagonia and Antarctica. Yes, it was wonderful. What a great time.
Oh, good. Oh, good. Did you notice increased endurance from your patches?
I can't have any more endurance than I have. I have.
It'll scare
nothing
people
to
away.
see.
Okay, well, let's jump in then and talk a little bit about LifeWave and what got you interested enough to dig a little deeper, because not all MDs are as open as you are, and you were open. And so what is it that got you interested, excited enough to even try it for yourself?
Oh, I had a colleague that was having good results and wanted me to take a look and see what I thought about the patches. So out of respect for my colleague, I said, sure, I'll give it a try. And I've had great results. I've been very, very impressed with my own personal benefits and close friends, family, and eventually patients.
Isn't it wonderful that we have something, as Dr. Nicholas likes to say, enhances the clinical outcome so simply and safely? Yes, I love it. So this wonderful technology and this special patch called X39, who is it for and who isn't it for?
So I think that when we think about some new phenomenon, some option, we think about people who are diseased, who have various symptoms and difficulties, and how these things might help them. And X39 has been helpful pretty much across the board with all types of situations. But I think that this kind of a opportunity is also good for the healthy and young that want to stay that way into their later years and want to enjoy all aspects of health and vitality.
It feels pretty good to keep getting younger, doesn't it?
It feels good to feel good throughout your life. None of us want. You always hear these things that I don't want to get old. Well, hogwash. We take care of ourselves. We eat well. We do everything in order to get one day older and 1 week, 1 year older. What we don't want to do is get decrepit at any age. And no one wants to live in pain and anguish and have to struggle from moment to moment. But while we have a vital life, then let's maintain that and do the best we can.
So I love that. And it's like every day we get to hear amazing stories of people that gives them hope that the future can be even better. And it's just so wonderful. So you have your cat.
We were about to be joined by Dorothy.
Hello, Dorothy. Yeah, I have a few under my foot, I think.
I haven't tried that technique.
Yeah, well, I have yes, I have a few dog beds under there. So let's talk a little bit about X39. And when someone uses this technology, how long can people expect?
Go ahead.
Hello, Dorothy.
I'll just ignore the man behind the curtain.
Okay. All 5 of our animals wear patches, by the way. So how long can people expect to notice something when using this X39?
How long can I expect it? As long as they're alive? How long
To
before they start to feel it?
notice it.
To notice it before they
Yes.
notice it.
Yes.
I think that I'm probably in a minority. I'm a very rapid responder. I feel benefits very quickly. You're going to be a pest, Dorothy. I feel things very quickly, whether it's relief of pain or increase in vitality. But I think the majority of people will find benefits over a few days to 2 or even 3 months.
And how long do you recommend people use the patch before it's working, it's not working?
Before they quit? Well, I think it's important to have some good quantification to get an idea of when it's working, because when things change in our busy lives, we may not notice it unless if we're tracking it in some way. So keeping track and maybe not just focusing on the one symptom that you were thinking about improving, but more about your general health. And give it that 2 or 3 months opportunity to see what you get.
Great. Yeah, some people, like you said, can notice things literally almost immediately, and other people it's much more subtle, and some people it takes a lot longer, but it is always working. I mean, I wanted one very specific thing, and it took about a week for my knee pain to go away, but then I put the patch here and the knee pain went away in a week. It's like, what? Yeah. It's just like crazy. And then I started noticing all these other fun things, like my deformed finger straightened out. It's like, really? And so like you said, paying attention and doing a baseline, and we do have a health tracker, everyone. And if you're new to LifeWave, please ask the person who shared it with you to get you a health tracker so you can get a nice baseline and know what to pay attention to, because there's a variety of benefits that everyone can experience from this. So from your perspective, Dr. Stuart, what are the conditions to really have this technology be most effective in the body? Hi, Dorothy. She wants to.
What are the conditions to get good results? I think that it would be the same answer for almost anything we want to try in life. We do best when we don't send our health out to the cleaners for somebody else to take care of. We take care of it ourselves. So if you want to get healthier, well, you can use things like X39 to do that, but you want to give yourself support. You want to make sure that you are eating healthy, that you are maintaining exercise, that you're keeping your mind and body in a good, gentle spirit, and avoiding toxins in your environment, et cetera, making sure that you're getting adequate nutrition, adequate fluids.
So we have to do our part. The patches are amazing. So you said adequate fluids, and how long do you wear the patch?
I wear mine, well, I exceed the 12 hours. I go about 14 hours on. And then you give your body a break. And then I give it a break for the 8-10 hours of sleep.
Okay. And how good are you at being consistent?
Almost sometimes very good.
So consistency, fluid, give your body a break, 12 hours on, 12 hours off, 14 on, 10 off, but give your body a break from the signal and it'll be most effective. Yeah. Are there any contraindications or things people should be watching out for that may be less than pleasant for people?
Very few. Some people will notice very minor, symptoms, whether it's some itching where the patch was put. Someone told me that their skin paled in one area where the patch was being put. There is a theoretical concern with people who are on intentional immune deficiency, where a physician is depressing an immune system to keep an organ transplant in place or to do some form of chemotherapy. And theoretically, by improving the immune system, we might overcome what the physician is looking for. That's theoretical. I have not experienced that in my practice with people who are under similar situations, giving them immune support. So it's not something that is high in my concerns, but it's something that has to be considered.
Okay. And can some people maybe feel worse after they use it, or does everyone just either don't notice or they feel good?
Any physician that has practiced, natural medicine knows that some people go through what we term a healing crisis, that they may feel worse as their body is in the healing phase. So yes, you may have a worsening of some of your symptoms early on, and you just continue to improve from there.
It's actually a good thing. It means it's working.
Yes.
Even though it might not feel good, that actually did happen to me with my upper arm. I had an injury and I started wearing X39 on the top of my spine, and all of a sudden I got this like pain in my arm that was a past injury, and I guess it wasn't finished healing. And I talked to Dr. Nicholas. He goes, "Oh, good." And I went, "Yeah, it doesn't feel good." And he said, "Keep it on as long as if you can handle it. If it's too much, just take it off." And we're back
for shorter periods of time.
Yeah. And so now it's completely gone and I am fully healed, and it's not even, I don't even know the spot anymore. It's not even tender. So I'm thrilled. Okay. So what else would you like to share before we open up for some stories and questions from our participants?
Oh, I could share lots of personal experiences and client experiences, but let's go to your questions.
Okay. All right. So thank you everyone for sharing symptoms only. So I'm going to start out with Brenda, and she said, if someone uses silent nights all the time, will their body stop making melatonin on its own? I heard this can happen when people take melatonin supplements.
No, in both situations. There is a concern when people take adrenal hormones, steroids, cortisone, prednisone, that it suppresses the adrenal gland. Other glands don't seem to have that issue, and it has never been described with melatonin for the pineal gland.
Great. And my understanding, and correct me on this one, is that what the frequency of silent nights does is activate the building blocks so your body creates its own melatonin.
Well, that too. The mechanism is different, but even people taking, and I'll have a cancer patient that I may have on 20 or 40 milligrams, 60 milligrams a day of melatonin. It does not suppress their pineal gland at all.
Wonderful. Yes, that someone very close to me took high doses of melatonin for that kind of treatment, and it was very effective. So very exciting. Okay, Rainey, thank you so much, Brenda, is asking, is it harmful for an immune suppressed person who takes a biological shot every 2 months to use X39?
Yeah, consistent with what I answered before, not in my opinion.
Yeah, our experience is there's no interaction with injections or medication of any sort. It's a different
Or it's
frequency.
anything that suppresses the immune system. But I
Great.
don't think X39 would have a problem.
Okay. All right. And then thank you so much. And now we have Ravel. She has a new friend, Gail, in North Carolina, who suffered from severe pain and had a heart attack after many medical procedures since 1995. Not sure if this is a medical term. She has some kind of, I think it would be a nervous system dysfunction. I don't think that's a diagnosis, an autonomic dysfunction. Please comment on whether the X39 eon glutathione ice wave would be supportive or what might be better.
If the autonomic system is dysfunctional, I think that X39 as a foundation for any treatment. I mean, after all, what's not going to improve if we have more stem cells to do repair work for us? It's how our body tries to repair regardless. I think glutathione and eon may also be helpful. You could certainly experiment with ice wave. I imagine this is a pain syndrome that they're talking about then. And you may find benefit in a systemic use of eons, such as on the balls of the feet.
Okay. Would X49 be supportive?
Certainly with myocardial injury, and yes, actually it can be supportive with brain injury too. We've been thinking about using it with autistic children to help them support their recovery.
Okay, well, thank you, thank you. Very good to know. So Rich is in the Philippines, so it's morning over there. So hi, Rich, nice to have you. She says she has a 64-year-old who's been in pain for 10 years from problems with her nerves. What patches would you recommend and where? And she has recommended, I have recommended a protocol, but it helps to hear it from a doctor. Thank you, Rich.
Well, whoever's recommending it knows where the pains are. So if it's generalized, what we just discussed, if there is a more localized pain syndrome, then you may try using the ice wave at the extremes of the nervous area or surrounding a more localized area, doing this technique of putting the brown patch in the middle and trying different locations for the white patch around that central area.
So what if it's just, throughout the body and systemic?
Then I like using a technique of putting the white patch on the ball of the right foot and the brown patch on the ball of the left foot and trying to get a systemic approach that way.
Great. I've had amazing results with that. It's the kidney 1 spot on the bottom of the feet, and ice wave is a 2-patch system, so that should be very helpful. Thank you for asking, Rich. Casey says a customer has a very thick skin and callus on one heel. She's tried various balms, creams, oils, soakings, but after a little while, the hard callus comes back and is painful. Is there anything we can do with our technology for that?
I'm not aware of a patching technique to decrease the thickness of callus. But yeah, when calluses build up, they can become quite painful. We use a technique with a scalpel blade to shave that down, or you can very carefully use a pumice stone. Often, like after a shower or bath, and the skin is softer, just be really careful to do that very softly and slowly, because the soft skin will abrade quicker than you are expecting, and you may damage your skin underneath.
I wonder if aloe vera might be helpful. What do you think?
I think any sort of a moisturizing cream, but I don't know that you'll be a specific benefit from aloe vera over any other. I don't know that.
Okay, it's worth trying. Yeah, okay, it's a skin condition. All right, and Rich is back again. I have a friend who's in pain. Both base of the thumbs are swollen. Water intake's good. She started using Ice Wave one hand at first. Can she use 2 pairs of Ice Wave, one on each hand? Any recommendations about X39 at the base of the neck? Any other recommendations? She's on her 3rd Ice Wave, but still in pain.
Yeah, I always have pain here. It's one of those chronic conditions. Even shaking my hand was very painful to me. Over the years of using X39 and other patches, it's gotten a whole lot better, but I still feel it. I would periodically try putting an X39 right on that spot. I tried Ice Wave on it, Eon, glutathione. They can all be helpful. Try it, work with it, experiment, and see what works best for you, the individual.
Yeah, thank you so much for saying that, because in one of David's recent videos on pain, he talked about using Eon and glutathione, and you can, we have a very technical term called pancake. So you can put them right on top of each other, right on the spot. And it seems that that combination can really make a difference. So try it. Always X39. Always as a foundation. Thank you. Thank you. Okay, Glenn, Dr. Stewart, I have a lady who has some immune problems and only gets 3 to 4 hours of sleep. What do you suggest?
Get more sleep. Yeah. I'm not sleeping because of the pain, I presume. So the treatment is directed at relieving the pain so that the sleep can have its natural course, and depends so much on where the pain is. Again, trying X39 directly over the site of the pain, or for more systemic pain, some of the patching techniques that we just talked about. Ice Wave Energy Enhancer can be a helpful patch for pain as well. There's another 2-patch system like the Ice Wave.
Okay.
So much on what other stuff is going on and what's causing this chronic pain.
This was a sleep challenge with the immune problems. Typically, we don't really have the time here to ask the different questions why people have sleep challenges, but there's many different reasons that people have sleep challenges. So reach out to someone in your team that might know more and go through that series of questions, because there's different reasons that people have sleep challenges. Yeah. And it's really important to get sleep, like you said. Okay, this is a good one, I think, for people to learn about. A friend asked me about, can they use the patches if they're on dialysis?
Yeah.
Good answer. I do want to share a story, because I've heard 3 different stories. The first one was a nephrologist told this person, I've never done this. I'm reducing your dialysis from 3 times a week to 1. And they were using X39. And then there was an 83-year-old woman that her nephrologist actually, after several years of being on dialysis, was taken off dialysis. And I had never heard of that before. So that was pretty exciting. So a very good thing to try. Yes. Francine, I have a prospect that has issues with sleep. Tonight's a sleep night, isn't it? However, she has a concern of the use of X39 because she had it. She has had for 32 years a condition where her immune system attacks its own tissue. Do you think there's any issue with using X39 or any of the other patches?
No.
Isn't it wonderful that it's so safe? Even if you're on medications, no contraindication or interactions. That's wonderful. And yes, X39 is so comprehensive. It does so many wonderful things. And let's see.
I'm really concerned about something that just makes your body healthier from its own basic mechanisms. It's not putting anything in other than giving it its own ability to get healthier. So
great. Okay, and finally, we've gotten to Rose. I think that's our last question for this evening. For super high cholesterol and sugar, what's possible patches to be used?
Okay, so all the patches that we can manufacture are to be helpful for somebody with the terrible effects of diabetes. But recognize that diabetes is a disease caused by our diet. I'm talking about type 2 diabetes, not type 1, where an autoimmune effect has damaged our ability to make insulin. But in typical type 2 diabetes, it is an evolutionary change in humans that increases their uptake of calories from sugar and starches, and avoiding sugar and starches in the diet is fundamental. And for most people, it will clear up the lipid problems, the blood pressure problems, the cholesterol. The sugar gets better. Just getting rid of sugars and starches in the diet.
So back to what you said earlier, we have to do our part. And there are many conditions that lifestyle can completely control. And this sounds like one of them. So thank you so much for that. We do. We've got to do our part and make some changes. And there's certain conditions that are very, very responsive, and it sounds like this can be one of them. Okay, well, let me see if there's anything else. Kamei says she's got a couple of clients who have a disease that the immune system eats away at the coating of the nerves. What would you suggest for that?
These are called demyelinating diseases, where the insulation that wraps around the nerves is destroyed. I've had really great results, and a lot of my patients with various neuropathies, pathologies in the nerve that have cleared up their symptoms with X39 as the foundation, and really ultimately just X39 over the long term.
Beautiful, beautiful. Yeah, we've heard many stories of people having tremendous results with X39 in the nerves. Tremendous results. Okay, I think we had, I think that's it. Oh my goodness, we did it. Yay. And we're only a few minutes, a little lot more than a few minutes. So that was wonderful. We're so grateful for all of you that were here this evening. And if you're new, please reach back to the person that invited you, because this is something very, very special. And the product does come with a guarantee. And we just invite you to get started. We have a wonderful customer program. If it's just for yourself, if you're the kind of person that likes to share, then you can become a brand partner and get compensated for sharing with people. And so thank you for being here this evening, everyone. Special thank you to Dr. Stuart. Always great to see you. Thank you, Gregory, for your wonderful presentation. And thank you, everyone, for joining us. And Happy New Year. And like Dr. Stewart says, this is a really good time in the beginning of the year to really do some self-assessment and look at maybe some of those things and lifestyle choices that can, have you enjoy being in this physical body even more. So drink your water, move your body, eat good food, and laugh a lot. Okay.
Good day, everybody.
Good night. Bye-bye. Thank you.